Okay. Hello, I am Leslie McGee with the Adult Protective Services Technical Assistance Resource Center, or APS TURC. Welcome to our presentation, Why Your Case Data Matters, Your Clients, Your Program, and NAMRS Reporting. Next slide, please. Before we get started, I want to go over a few things. This webinar was created by the APS TURC, administered by WRMA Incorporated under contract number 140D0424F 1178 from the U.S. Department of Health and Human Services, Administration for Community Living, Administration on Aging. The views expressed in this publication do not necessarily reflect the views or policies of the Administration for Community Living or the U.S. Department of Health and Human Services. The models and information provided during this webinar do not serve as official guidance to comply with any part of the APS final rule. All information is provided for informational purposes only. Next slide, please. A little bit about who we are. Our mission is to enhance the effectiveness of APS programs, and we do this by supporting our partners' use of data and analytics, working to apply research and evaluation to practice, encouraging the use of innovative practices and strategies, and providing individualized TA to APS programs. Today's presentation is being recorded without a live audience. Should you have any questions after viewing this recording, please reach out to the APS TURC team using the contact information provided at the end of the presentation. We will be happy to discuss any questions you may have on this presentation, as well as any ways that we can assist you. Next slide, please. We hope you leave this webinar with a better understanding of the importance of NAMRS and how case documentation results in the NAMRS data that is used to support and improve APS programs. We are going to discuss what NAMRS is and why it was implemented, as well as our ongoing efforts to improve case data through case documentation. And then we're going to wrap up with where we're going from here. To everyone watching, we encourage you to share this webinar with all of the APS professionals in your agencies who perform direct service casework or supervision duties, as well as those who support the day-to-day program operations, because we all have a role in improving the data that drives system improvements. Next slide, please. Joining me today for this presentation are two of my colleagues from the APS TURC, Carl Urban and Andy Capehart. And at this time, I'm going to turn it over to Carl. Next slide, please.
Hello, I am Carl Urban. I work for the APS TURC, and I am going to give you the background information on understanding why NAMRS is important. So we should start first with the next slide on just understanding what is NAMRS. NAMRS was established by the Administration for Community Living for the purpose of understanding the phenomena of adult maltreatment, and we'll talk a little bit more about what that actually means. ACL wanted to be able to collect consistent, accurate national data on the exploitation and abuse of older adults and adults with disabilities, as reported to APS state agencies. When the Elder Justice Act was passed several years ago, they had the mandate to implement the NAMRS system. So, next slide, what exactly is NAMRS? And just to kind of run through the words, the letters in the acronym, NAMRS is a national system. It collects administrative data from all states, territories, and DC. So it's universal in terms of covering the entire United States. It focuses on adult maltreatment. So by adult maltreatment, we are talking about adult protective services. All of those states, territories, and DC report data from their APS programs to NAMRS. NAMRS is a reporting system. It's not a case management system. It's a system to collect that data from the APS programs, and it collects two basic kinds of data. The first kind of data we call the agency component, and it is data on policy and administration that gives us the background and the context to understand the more performance-related data that programs report. And so that more performance-related data is information on the cases that were actually investigated in a given fiscal year. And we collect that one of two ways. We either collect it as what we call key indicator data, and that's summary level data, or we collect it as case component data. We prefer to get the case component data, the more granular, detailed data on every case, but not every state's able to report it that way. So we also collect from some states the key indicator data that kind of rolls the data up into summary level data. One of the things that we want to encourage is and help is more states to get to where they are able to report case component data. So why? Next slide, please. Why did ACL implement NAMRS? And we've talked about this a lot when we talk about NAMRS. Data is really the key to unlocking many doors to improving APS services. This is all done with the goal in mind of improving services and improving client outcomes. And part of what we want to do today is help you to understand how we get from collecting data, how we get from what you document to improving outcomes. And so to get there, we need to have a better understanding of what APS does. And I'll show you some ways that we actually do that. Data becomes a key thing for the advocacy for resources and improvement. You have to be able to tell your story of what you do, and the only way to do that often is with data. If you're going to improve services, then you need to understand them better. And so it becomes a key aspect of the research and evaluation work that we do here at the APS TARC, and it's a key resource for others that are wanting to do research and evaluation work in APS to help us understand and therefore improve the services. All of that, the understanding what we do, the advocacy, the research and evaluation translates into best practices and service innovations. So let me show you on the next slide somewhat specifically how this translates into real world information. So this is a slide that shows data that we produce every year in the adult maltreatment report, and we call it data at a glance. And what you see here is a snapshot of what APS looks like around the country. You start in the upper left-hand corner with 1.5 million, 5 million referrals of alleged maltreatment that are received by APS programs every year. 42.2% of those are screened out, and so on through the flow chart that you see there. And you can understand all the aspects of APS investigations that go on at the nation. It's amazing how many people don't know or understand the breadth of what happens in an APS program, especially nationally. And so here in one picture, they can follow that flow from the reporting at intake all the way through the services at the bottom of the chart, the number of persons that are receiving services every year from APS. So next slide. Here are some of the specific ways that we have used the data and how it translates into program improvement. And so when ACL, for example, was working on the final rule that they developed for APS services, they had lots of questions about how many APS programs do this, how many APS programs do that. And so the NAMRS data was able to help them craft a rule that was based on the reality of what was actually happening out in the field. And we knew what was actually happening out in the field because we had the data that we had collected through NAMRS. The other thing, and this relates back to the advocacy one particularly, is that the media, public officials, and Congress and the public often have questions about APS. Tell me what APS is doing. Tell how much this is doing. And so when those questions come in, we now have a data resource to be able to answer those questions, which we did not have before. Research and evaluation is a critical use of NAMRS data. We have done a national APS process evaluation. We have done a national first of its kind outcome evaluation. Other researchers have used the data, and so it becomes a critical resource for research and evaluation to understanding how adult maltreatment is actually addressed in state programs around the country. And then the final way that I will talk about from a federal perspective here is what we do with the data here at the Adult Protective Services Technical Assistance Resource Center. Our job is to help state APS programs improve, to implement those best practices. And so we routinely get questions from state APS programs about policy and practice. How many people are doing this? Who does that? And so we have a resource that before NAMRS did not exist, in which we were able to call upon it to help us answer questions and provide that direct technical assistance to APS programs. So you may be going, that's all good at the national level, but what about me at the state level? So at the next slide, please. Here's some things to think about from a state or a local perspective when it comes to NAMRS and how does it benefit you. The first thing is that NAMRS was developed with the input of a lot of national experts. ACL was able to pull together a bunch of really smart people that know a lot about elder abuse into one room and to say, okay, what do we really need to know about APS across the country? And they designed a data system that reflects what the experts thought was needed in APS programs. And so that translates and communicates back to states. These are the things that the national experts think are important, and you're sending that information to us is really helpful. And so if you go down to the next set of bullets, one of the things that translates into is we are building out of NAMRS a data system that provides reports back to states on those things that the experts think are important. There's nice summary reports in NAMRS that states are able to use to understand their program better. And this knowledge and this understanding allows states to refine and enhance their APS data systems to focus on the things that these national experts thought were important. Ultimately, however, in terms of understanding and looking across states, as we share cross-state comparisons, the data becomes a real resource for programs to use to benchmark themselves, to try to understand better where we compare to some states relative to other states. So let me show you an example of that on the next slide. A minute ago, I talked about that national APS process evaluation that we did, and here's an example of how we use that data in that evaluation. We looked at what we called system outcomes in the evaluation, and there were 4 different system outcomes, and they related to key decision points in an APS case. So was the data reported? Was the allegation reported? Was the allegation accepted? Was the allegation substantiated? And was the client receiving services? And so as you look at this series of 4 charts, each bar of which is an individual APS program, we suddenly get a really good picture and an understanding of what is going on across APS programs. And if you're in an individual program, and I highlight your bar, you can see how you compare to other states and have a much more in-depth understanding of how your program operates relative to all of the other programs in the country. So one last thing I would point out looking at these charts, you see a whole bunch of bars in the first 3 charts. You don't see as many bars in the 4th chart on percent of clients receiving services. And so one of the struggles that we have in NAMRS is trying to get as complete a data as possible. So next slide, please. For us, complete data sets are essential to doing a better job with the analysis that has to be done. The more complete the data, the more accurate our analysis. The more accurate our analysis, the better our decision making is. The better our decision making is, the more effective modeling we can do as we try to think about the best practices for future program improvement. Missing data runs the risks of us missing patterns or insights. It runs the risk of us drawing inappropriate conclusions from the data. So as we move forward, one of our goals is to try to understand and address reasons why states struggle at times to provide complete data to us. So next slide just gives you a very simple example from the 2023 Adult Maltreatment Report of where we have missing data. So for APS clients and victims, you can see there for race, ethnicity, and disability, there's a lot of missing data where we don't know race, we don't know ethnicity, and in particular, we don't know disability. And when you're talking about disability in APS, it's a really important factor in determining eligibility. It's a really important factor in determining capacity. It's a really important factor in determining what types of services someone may need in terms of putting together a service plan. The data is really important for you in your casework. It's really important for us in our analysis of how to try to improve practice. And similarly, you can see for perpetrators, we even have a bigger gap in data. So our encouragement to you is to try to collect as much data and document as much data as possible. So all of those things that I just described that we're using the data for, we can do it with the best possible data set, leading to the best possible conclusions and the best possible improvements for your programs. So Andy is now going to talk about how you're improving your documentation improves your data.
Thank you, Carl. Next slide. Again, thanks, Carl. I'm Andrew Capehart with the APS TARC. I'm going to talk a little bit about how improving documentation improves data, just like Carl said. Next slide. So the importance of quality case level data. Data is the key to unlocking the doors to improving APS services for all of us. Data helps us get a better understanding of what it is that APS exactly does, advocate for resources and system improvement, and successful use of data hinges on the quality of the data itself. So here's a few characteristics of quality data. It's complete, and this means there is as much of it as possible. So an example is making sure that you enter race and ethnicity in a client file instead of just one or the other. That gives us a better picture of what's going on with that particular case. It's accurate, meaning you ask your clients questions instead of just guessing what the answers are. For instance, you may have a client and you assume their primary language is English because they speak it very well, but in fact, their primary language is Spanish. That's helpful to know as well. It's also timely, so you're entering the data as soon as you can, and that equals better quality. Just like with case notes, we hear that all the time. The quicker you put the case note in, the better quality it is. The same is true of data. And it's consistent. So following these sorts of practices regularly and making them a habit, not just a New Year's resolution that you abandon, is very important. So, and also we've all heard if it isn't documented, it isn't done. This goes just for more than just case notes. Entering data into fields into your system is just as important as documenting the case notes themselves, as I mentioned a moment ago. And finally, case notes just aren't good for analyzing data, the type of data that Carl was talking about a little bit ago. It's very, very difficult to extract information that's entered into a narrative field. I'm going to talk a little bit about that on the next slide. But an example is if someone wants to research a client's what client's diagnoses are, and that information is in a case note, they have to read all the case notes. And we know that can take a very long time in order to get that information. So this is a good time to talk about what we mean by case level data, quote unquote. What exactly are we talking about there? So for today's purposes, we're talking about quantitative data, not qualitative data. So some examples of quantitative data are numbers, like a client's age, what their income is. It also includes multiple choice options like race and ethnicity that I talked about a little bit ago. What we're not talking about today for case level data is qualitative data, which includes case notes, any narratives in your system anywhere, and any free-form descriptions. So if you have an option in your system where you can check or select other, and then you fill in a box next to that, that would also be considered qualitative data and not something that we're really talking about today. All the qualitative data isn't entered into NAMRS. I'll talk a little bit more about that shortly. NAMRS only collects quantitative data. Next slide. So here's some quantitative data 101, a little bit about quantitative data and its characteristics. Again, it's numerical data. As I mentioned earlier, this data focuses on what can be counted, what can be measured, and what can be categorized in a standard way. Quantitative data is used in statistical analysis. If any of our listeners today have had a stats course in college, you may be rolling your eyes or groaning to hear about that, but that's the sort of data that's necessary. This is the sort of data that's necessary to do that statistical analysis, like correlation, t-tests, and analysis of variance. And also, quantitative data is generalizable. It often uses large sample sizes, many clients at one time, such as what we have in NAMRS, which contains de-identified information on millions of referrals to adult protective services. Finding patterns in this quantitative data can reveal a lot about the people that we serve. Next slide. So now let's talk a little bit about the kind of data that NAMRS does not collect. And I've alluded to this already. All forms of data, including qualitative data, are important, but not all that data goes into NAMRS. NAMRS doesn't get any of your case notes. So all that time that you spend on case notes, that information stays with your system. It does not get transmitted to the NAMRS system. Those stay just in your local area or with your state. And we don't collect any personally identifiable information on PII. This includes things like name, address, date of birth, social security number, addresses. We don't have any of that information in NAMRS, and we don't actually want that information so that we can maintain the confidentiality of your client. So all of that sort of thing doesn't get transmitted to NAMRS. We don't collect any of that specific information. Next slide. So you may ask, why are we talking about all this? Because the data you enter into your case has much broader implications than just for that specific case of yours. Data is used to determine state, federal, and local services, dollars, and policy. So an example of this is census data, which I'm sure all of us are familiar with. They collect census data from us every 10 years. And that data is used for many, many different purposes. A few examples: transportation. Bus routes are often built based off of census data by people that use public transportation and how big populations are in certain areas. And then new schools are often built based on the number of school-age children in a specific area. So that census data is pretty important to everything that we do in our lives. And so here's an example of how NAMRS data could be used in the APS world. When you enter veteran status into your case, if it collects that sort of information, that info is transmitted to NAMRS if it's been input by you into that case. Veteran APS client numbers could be used in the future to determine if there's a need for collaboration between federal or state VA services, and if increased services are needed for veteran APS clients. So that's an important potential use of the data that we collect. Next slide. So you may ask, what's in it? For me, improved data equals improved efficiency. If you enter data into quantitative fields, you typically don't need to add them into case notes. And I don't know about you, but when I was a worker a very long time ago, I would do anything to do less case notes. So if you're putting, let's say, diagnosis information, medical diagnosis information somewhere into your system, you wouldn't necessarily need to put that into your case note, and it could reduce the amount of typing that you have to do when it's time to do your case notes. Better data means consistent documentation and makes it easier for supervisors and quality assurance staff to review cases and don't have to bother you if they have questions about what's been done on a case. It helps to tell your story. It helps decision makers understand the importance of the work we do and determine how we help people and what we need to do our jobs. And it helps you get what you need. You may have a serious lack of services in your area, and better data demonstrates the need for better services. Data generally strengthens the services for our clients. If there are considerations of cutting services, those cuts may not be made if the data can show that they're very necessary. And it helps to build professional credibility. We work with systems that have, sophisticated data collection opportunities, and it shows that we are just as sophisticated as the justice system or any other system that we work with. And it also helps us to evaluate the job that we're doing and determine how we can do that job a little bit better. So these are a few reasons why it's important to enter that quantitative data. Next slide. And I think at this point, I will turn things over to Leslie.
Okay, thank you, Andy. Let's go ahead and wrap this up. Next slide, please. So today's discussion has been about how case documentation becomes the data needed to support our common goal of protecting vulnerable adults and keeping the APS system as a whole moving forward. We have only been collecting and compiling National Adult Protective Services data through NAMRS for the past decade, and incomplete or inadequate documentation decreases the usefulness of the data. As Carl and Andy discussed earlier, we know that NAMRS data provides the framework for policies, funding, and operations at all program levels, local, state, and federal. It supports research being conducted in the field. It helps to identify our clients' service needs and what resources we have or need to develop to meet those needs. And it is used to increase public awareness of adult maltreatment and educate the general public about who we are and what we do. For all of this to happen, we need to have confidence that NAMRS data provides an accurate and representative picture of APS. So how do we build that confidence? Next slide, please. Having confidence in NAMRS data comes from knowing we have quality data. ACL has identified a list of specific NAMRS data elements for improved reporting, and the APS TARC will be working with states to assist in this effort. Some of the elements listed here provide insight into program operations, such as screening and case assessment practices. However, most of the priority elements were identified to help bring the picture of adult maltreatment into clearer focus. These data elements will help us all better understand the prevalence of maltreatment, who our partners and collaborators are, what our clients need, and because it is one of those areas where there is little data, what services are in place or not to address those needs. Much of this information is client-specific and is compiled from the case-level data submissions. As Andy alluded to earlier, we get the numbers, do the statistical analyses, and through that large sample, are able to generalize the information into a national picture. The de-identified and encrypted case-level data pulled from case documentation is the background for that national picture. It can best be provided by states submitting client-level data to NAMRS. And again, I want to stress that all data submitted to NAMRS is de-identified and encrypted because no PII or personal identifying information is collected, as Andy said earlier. Next slide, please. We recognize that caseworkers and supervisors are the most critical people to the work of APS because you're out there in the field. However, the work to improve data quality does not rest solely with you. We are here to support your work and also to work along with your state in this effort. For the past several years, the APS TARC NAMRS liaisons have been doing state-specific analyses of data submissions and discussing them with states to help us better understand the nuances in your data. For example, what data elements are required versus optional in your state data system, because that informs what you prioritize in your case documentation. And what is collected in data fields versus narrative fields, and therefore cannot be submitted to NAMRS, even though you've documented it. We use these discussions to troubleshoot submission issues, understand program policies and practices that are impacting data, and identify potential future enhancements for NAMRS that will make it more efficient for states to submit the data you record. Excuse me. As Carl noted earlier, we've been working to make NAMRS state-level data publicly available. While it may be used primarily for research, it will also provide your state with opportunities to compare your data with other states to help identify areas for program improvement. And of course, The APS TARC is here to help for technical assistance and training needs. There are more NAMRS webinars scheduled for this year, and we also recently provided subject matter expertise for a NAMRS e-learning enrichment course currently under development for the National Adult Protective Services Training Center, or the NATC. And just really quick, for those of you who are not familiar with the NATC, it is a project under the Administration for Community Living, responsible for designing and delivering quality and accessible courses for APS frontline professionals like yourselves, supervisors, and leaders in all states and territories. Next slide, please. So here's the thought I want to leave you with today. Your data reflects your practice. Each data point submitted to NAMRS from client case records helps to tell the story of what is happening in APS every day, and it has a ripple effect, contributing to the national picture that informs the road ahead for the APS system. I have just one ask of you. Please remember to share this information with your colleagues in your jurisdiction. Next slide, please. If you have questions about anything in today's presentation, please feel free to reach out to your NAMRS liaison. Or if you don't know who that is, you can reach us through the NAMRS mailbox, NAMRS support at acl.hhs.gov. Next slide, please. We encourage you all to follow the APS TARC through our social media pages shown here, or visit our website, apstarc.acl.gov, to access additional information and resources, and use the APS TARC Technical Assistance mailbox, apstarc-ta@acl.hhs.gov, to contact us for assistance. We thank you for your time and attention to this webinar and wish you a great rest of your day. Goodbye.